Hi everyone, the open enrollment to get health insurance is now up and running, and the Supreme Court is deciding the future of Obamacare once again. Half of people who call me to help them with their health insurance application or selection ask me about the subsidies. What's the income limit to qualify for Obamacare subsidy? What's going on? What's happening with the Obamacare next year? In this video, I will try to address these questions and help you make sense of these healthcare updates. Now, even though the ACA or the Affordable Care Act is a federal law, all the information and examples presented in this video will primarily focus on California. Before we get started, if you don't know me yet, I am an independent insurance agent in California. I have contracts with all the major carriers in the state. I'm also a Covered California certified insurance agent. So if you have questions or need help enrolling, please feel free to reach out and I will do my best to help. There is no charge for my services. If you found this video useful, please support me by liking, commenting, and subscribing to my channel. I always appreciate that. So let's start with the Affordable Care Act, also known as Obamacare. I will not get into the politics of the law and give you scenarios or opinions on what's going to happen with the ACA and how the Supreme Court will rule. I don't have a crystal ball, so I have no idea. But what I want to say is that your health insurance coverage for year 2021 will not be affected by these rulings. Again, your health coverage for year 2021 will not be affected by the Supreme Court decision on Obamacare. Even if a decision is made, likely in June of 2021, the new rules and regulations shouldn't take effect until the next open enrollment. In any case, we will keep an eye on the developing of these rulings, and I will have a separate video once there is more clarity on the topic. Now back to subsidies. They're also known as tax credits or APTC that work on a sliding scale. These subsidies basically decrease your monthly insurance premiums if you qualify. In order to qualify, your income has to be below a certain threshold. Here's a table that you can use to see if you qualify for subsidies or medi-cal, or as it's known as Medicaid in other states. Do not confuse medi-cal and Covered California. This is not the same thing. This table is a very useful tool. You can download a copy on my website or read more on my blog. Again, this table can help you determine if you and your family qualify for subsidy via Covered California or if you qualify for medi-cal program. This table is very easy to navigate. All you have to do is look at the household size and look across at the percentage of FPL to determine in what category your income is. For example, if you are single and your income is between $19,140 and $76,560, you may get a subsidy in the Covered California. Depending on the income, you can also qualify for the enhanced plans like Enhanced Slver 94, 87, or 73. This will reduce not only your monthly premium, but will allow you to have a lower deductible, co-pays, co-insurance, and out-of-pocket cost. If you are confused about all these terms, I will post for references links to useful resources and explanation in the description of this video. Let's take a look at an example. Let's say that you are a single individual, 55 years old, living in Santa Clara County, making $55,000 a year. Here are a few plans with subsidies available to you. Notice that the age, the zip code where you live, and the income are very important factors when determining what health insurance companies are available to you and at what cost. So based on this example, I've selected 3 plans for this specific for this example, right? So other options are available as well, but we will take a look at these three for now: a bronze plan, a silver, and a gold plan. I have a separate video where I go in the details and compare all the metal tiers side by side, so feel free to explore it. For now, let's concentrate on the subsidy. As you can see, no matter what plan you select, the subsidy will be standard. For this specific individual, the subsidy is $301.73 per month, which basically decreases the amount this person pays for their health insurance each month. If the income for this person is $19,000 a year, we will see lower monthly premiums, a higher subsidy, and also enhanced silver benefits. This enhanced silver, like 94, 87, and 73, are only available for individuals within a certain income category. If you reference the FPL table, you will be able to locate what that income is. So for the 55-year-old individual living in Santa Clara County with the income of $19,000 a year, the subsidy is $803.79 per month. Here are the same insurance companies that I referenced before, but now showing enhanced Silver 94 benefits based on the lower income for the same individual. The benefit and plan designs are identical for all these three plans, but as you notice, the monthly premium after the discount is different. Well, that is because, thanks God, we have free market and private companies are free to set their prices based on the laws of supply and demand without government interventions. Yes, so PPO plans are more expensive and there is a market for those plans. So next time you shop for a health insurance plan, don't just look at the cost. Look beneath that. Do some research and see, is this an HMO, PPO, EPO plan? Do I even need a PPO plan? Read the summary of benefits of these plans. If you need help with that, please reach out. This is what I do for a living and I will be glad to help. Now, I want to mention one more thing here. Notice that the subsidy for the plan in the middle is just $759.30. This is not a mistake. The thing is, the monthly premium of the plan is actually less than the subsidy itself. So maximum subsidy is applied in this case. Now, again, don't judge just by the cost. The plan for $1 is not any worse than the plan that costs $465 a month. It's just a different network of doctors. It's a local network. Now, when you're shopping for health plans and are estimating your subsidy, you will have to be very careful with the income that you are including in the projection of the subsidy. If you don't enter your income correctly, this will cost you later. Remember, if you are shopping for a health insurance plan for year 2021, you will have to enter your estimated income for year 2021. Not what you made in 2019, not what you made in 2020, but what you expect to make in year 2021. I know it's very hard to estimate the income a year in advance, but this is the most accurate way to estimate your subsidy in the year of your reported income. If you have no idea what your income will be, do your best to estimate. Include an annual average salary. If you underestimate your income, you will have to pay back the difference at tax time. If you overestimate your income, then you will have to pay more in premiums for your health insurance each month. In any case, if you have access to your Covered California application, you can change your income anytime and the subsidy will adjust accordingly. If you're still confused and don't know how to enter your income in the Covered California, please feel free to reach out and I will do my best to help. It's very important to do the estimate correctly when you apply. If your income is just $1 higher than the cutoff, you lose all the premium subsidy, which can be well over $10,000 depending on the age and the household size. So be very careful. We haven't looked at other examples, but you can easily locate the income limit, household size, and see where you stand in terms of subsidy. Now, as you notice, the table includes both the federal and the state tax subsidy. Not everyone will qualify for California state subsidy. Again, the income plays a big role in calculating this subsidies. Let's go back at our example of a 55-year-old living in Santa Clara County making $55,000 a year. The entire subsidy for this person was coming from the California state subsidy. And the subsidy of $803.79 in that example where the person was making $19,000 a year was coming from the federal tax credit entirely. Now, the income does not affect the premium on the dental insurance plans available in Covered California. The subsidy only applies for medical insurance. Dental prices are negotiated, so you may find unique plans available only in Covered California. And I really like the PPO plans who have only 6 months waiting on the major dental work instead of 12 months waiting period offered by the same insurance companies directly. Some dental HMO plans are also worth looking into for the orthodontic coverage. So that's all on this topic. If you have questions, please feel free to comment below. If you have a specific question, feel free to reach out directly or easily add me as your delegated agent in the Covered California, and I will be glad to help you with issues, plan selection, getting the Form 1095A, eligibility, etc. I do not charge for my services. Thank you for watching this video. If you believe someone might benefit from this information, please share.